All right. Good morning, everyone. Thank you for joining me today. I'm Dr. Scott Howard, Natural Health Chiropractic in Lubbock, and I'm on a mission to answer questions. So, a lot of people have questions about chiropractors, or they've heard something, and so they don't want to go, But what have you heard? Is your sources reliable? It's like listening to the news these days. Yeah, is that really trustworthy or not? So I'm going to actually try to answer some questions. This video, I'm going to cover, let's see, can you fix my pain? Whoo, boy, that's a tough question because, for one, everybody's idea of pain or sensation of pain is different. Some people come in and I can barely walk, and and I ask them, what, on a scale of 0 to 10, what would you give it? And they're like, maybe a 4. 10 being in the hospital, when it looks like it's an 8. Or I have some people that's just, it's just hurting a little bit, I'll give it a 7, which I would think it's a 1 or a 2. So pain perception is different for every single person. Okay, so we're going to go into the question of fix. Well, chiropractors really don't fix pain, or they don't fix people. What they do is realign joints and remove interference of the musculoskeletal system and the nervous system. So if a chiropractor removes that fixation of the joint, or removes any irritation by adjustments or any other method, by helping muscles, doing nutrition, some soft tissue, whatever, well, then it's up to your body to actually heal. So we don't fix it. We just remove the interference and let your body do what it's going to do. Now, if you've got degenerative joints, if you've got scoliosis, if you've got some severe thing that's going on, then we go in and try to remove that interference, but it's difficult because your body is in such a state of misalignment or degeneration, is that when we remove that, it's up to your body, and your body is not going to get a whole lot better. It could be because of degeneration. Well, we can't fix that. Now the degeneration may be there from either an injury that was not treated properly, or from long-standing chronic misalignments of the joints, and wherever the joint is, I don't know, but that joint could be misaligned for so long is that your body has now worn down because it's excessive stress at that joint, and it's going to cause degeneration or osteoarthritis, degenerative joint disease. There's another name, all kinds of names for the same thing. And so that degeneration might have been helped years ago and you would be better, but now that you're in this state, you've got pain from that, we go in and try to adjust or whatever, soft tissue or something, and it may help a little bit. So fixing pain, that question, it's a hard one to answer. So the way I go about treating patients is that I go about it by looking at several factors. They've got structural misalignment, they've got emotional issues, they've got bad eating for years, and so their diet, as well as all the toxic junk from bad eating, has filled up their system and given them made them more sensitive to pain, they're dehydrated. There's also electromagnetic aspect. There could be allergies. There could be a bunch of different things that's affecting their health. And so I have to try to address all of them. Now, a lot of chiropractors are just adjusting and that's it. Well, that's one piece of the puzzle. And there's a lot of things that tie to the spine, like an organ can be related to a certain area of the spine. Well, an organ can also relate to a certain muscle. Well, if that muscle is dysfunctional because of the organ being dysfunctional, then that muscle, wherever it attaches to, let's say it attaches to the pelvis and the spine, then that muscle is not going to work right, and therefore allowing the spine to go out of place frequently. And so when you just adjust, you're only trying to put that back in. But the cause could be an organ like a stomach or a ovary or a small intestine or a lung or brain or whatever. And if you don't treat that, and you don't treat the muscles and muscle balancing, you don't treat their emotions, electromagnetics, then you're not going to get really a good handle on the situation. Now, I can only do so much here. I can try, and a lot of people will, maybe from belief, maybe from time, maybe for money, but they'll not really do everything that I'm trying to do to help them. So they'll deny certain kinds of care, or they don't want to do anything for their organs or glands or infections, and so they don't want to do muscles. So anyway, if they only want adjustment, I'll do that. But that's not really getting to the true treatment that's available, that's possible to make a change in your pain. So hopefully that's going to explain it. I do a lot of extra stuff. I do a lot of complicated things. I do a lot of methylation testing, allergy elimination, nutrition, soft tissue, muscle balancing. So if you start doing all that, there's a good chance that I'll be able to help your body get rid of a lot of the pain. So, all right. So if you feel like, you haven't had success at other chiropractors, you feel like you've been to MDs and all the medical professionals, which usually are looking at symptoms and they're not looking at the cause, then obviously you're probably still in pain and problems. Definitely call me, and 791-0191, and we can do an exam, and I can just tell you if I can do anything for you. So, and then I'll explain, if I can, what it's going to take. So there's really no reason to just leave yourself in pain. I have more female patients because they feel something going on, and so they act upon it. Well, men, when they hurt, they just keep on hurting. They're like, go away. Oh, I don't need to. And then a year later, it's worse. And then they don't come in. So, and I'm like, guys, come in. What are you afraid of? So what? If it's a little bit of money or time or whatever, it's well worth it, because quality of life is much better than longevity of life. You can take a lot of drugs and just keep yourself going with medication and all this other stuff. It may lengthen the time you've got here, but it's a poor quality, and you want quality instead of quantity. Yeah, I said that right. Okay, all righty. Well, have a good one. We'll see you next time. Thanks.